All right, 25 million people in the U.S. have diabetes. Most suffer from type 2, and many are frustrated with what they say are limited options for treatment. But there is a new approach that could be right for you. Jason Shumard from the Integrative Wellness Center of San Diego is here and joining us. And Dr. Jason, thanks for being with us.
Thank you for having me.
Yeah, we were just talking in the break, so we have much to cover in this segment. But you're seeing a lot of improvements with people who come into your practice.
Yes, we are. A lot of patients come into our office and they really have no hope. You know, they're being told to exercise, lose weight, they're taking medication, and they're really not seeing any changes in their lifestyle. You know, they're still diabetic. I have a patient, for example, I was telling you a little bit about it. She was 400 pounds, and she lost 200 pounds on her own through exercise, through
remarkable.
diets. Very, very incredible. And what's crazy about it is her diabetes actually got worse.
When she lost the weight.
When she lost the weight. So what's interesting is that we're finding a unique approach that the diabetes has little to do with weight, with diet. I mean, there is definitely some things that need to be addressed, but what's really going on is what's the actual cause of the diabetes, and that's what our approach is all really about.
Well, let's talk about that, because diabetes type 1 and type 2, can you explain the differences between them, and then how many undiagnosed cases there may be out there?
Sure. So type 1 diabetes is actually, you know, it's someone who needs insulin. Their pancreas is not producing insulin anymore, and it's required. So it's really not any kind of curing, if you will, with that. There's only really managing it and helping that person out. Type 2 diabetes is actually a condition that's developed inside the body where the pancreas isn't really working properly and insulin is not being produced and working on a regular basis. So the persons really need to find out what is actually causing it, and that's what our approach is really about. Because right now the only approach is to give them medication, and they're giving, you know, 1, 2, 3 oral medications, sometimes insulin therapy, and it's just not really helping them. They're actually getting worse.
So you see a lot of frustrated people, I'm sure, who come into your office. What is their #1 complaint, and what can you do? You
know, their #1 complaint that I see on a regular basis is they're just not given any hope. You know, they're being told they can only manage it with medication.
Like type 1. Yeah.
Exactly. And so, you know, our approach is to, you know, help them. You know, these patients are really motivated. They really want to get better. And if we can only show them the right way to get better and show them how we can help them reverse their diabetes, they really will improve.
So what's different? What sets you apart from other places then?
It's really customizing a plan for these patients. You know, we really don't want to label them as a diabetic. We want to look at them as an individual. And once we can find out what's really broke inside their body, why they're not managing their blood sugar anymore, we can truly come up with the cause of what's happening and help them reverse their diabetes. And if we can do that, it's a much better approach. And our office is really about customizing and thoroughly testing their condition to help them really, or to help us really understand what's going on.
Okay, your interest in this first came because your mother is diabetic, and you said she's very small. She's 100 pounds?
Yes, she's about 100 pounds right now, and type 2 diabetic. She's changed her diet. They're trying to get her to eat more food, actually, and she has a lot of health problems, and that really truly got me into working with diabetics. And as you probably know, working with family is probably one of the hardest things. And
I can't imagine my mother.
My mom's, the hardest thing for her was to be motivated to change. And recently, she became very motivated. And because of one of the complications of diabetes is, you know, diabetic neuropathy, which can cause amputations. And her doctor told her, you know, you have diabetic neuropathy. She called me up and said, now my time's to change, and we've been working with her, and she's already making improvements. She's already reduced her insulin level intake. It's phenomenal. I'm really, really, truly happy for her. Okay,
really quickly, because we want to get to this offer that we have, but who can come to your office? Who do you advise to come? Because it's not for everyone.
Absolutely. You know, it's not for every person. You know, the main people that we actually really choose in our office is we have to determine first if we can actually help them. The second, like I mentioned, like my mom, you have to be motivated. There's going to be some changes, there are going to be some lifestyle changes. If you're not motivated, then definitely this program is not for you. We really want to make sure we're working with people who want to get better.
Okay, so the deal that we have here, for the first 20 San Diego Living viewers to call, if you qualify, at the point you have to qualify for this, you get 2 free consultations worth $490. That's a huge value.
Yes, absolutely.
Okay. Well, hey, Dr. Jason, we really appreciate you being here. We'll have the information linked to our website, and people, if you're interested, be sure to call in, because that is a good deal.
Thank you.
All right, good to see you.
Nice to see you too.
For more information, go to san diego6.com and click on San Diego Living.